Welcome to Sculpting the Soul, where we explore the art and science of transformative surgery. I'm your co host, Courtney Shaw, and today with me, I'm thrilled to introduce an incredible plastic surgeon, Dr. Kalus. Hello, how are you today?
Good, Courtney. Thank you.
Very good. So, in today's episode, I really want to focus on the difference between dermatology and plastic surgery. And when I first met you, I know we kind of started talking about it, and the perception that I had was that you had to go to a dermatologist for skin related things. And then I learned a whole lot different perspective on that. So, share a little bit about the options that our listeners have today when it comes to things regarding their skin.
Sure. So, Courtney, there are many definitions of plastic surgery, but one of them is surgery of the skin and its underlying contents. And I think that's kind of a cute, but actually fairly accurate term because a lot of our listeners might think that it is just skin deep, what we do as plastic surgeons. But when a patient wakes up one morning and notices something on their skin, whether it's a mole or a bump or a cyst or a little ulcer, anything like that, the first thing they're going to think about is, gee, do I need to get this checked out? And the skin is the largest organ of our body. And we all have things on it that other than just perfectly smooth, blemish free skin. We've got pigment, we've got moles, we've got all kinds of things. And the diagnosis of what we have, understanding whether this is something that needs to be further looked at by a doctor, possibly biopsied, really falls under the expertise of the plastic surgeon and the dermatologist. Both are qualified to identify something that perhaps needs a biopsy. The family doctor is probably also pretty well qualified, and the internist. So dermatology and understanding basic dermatology is part of what every doctor ought to know. But the doctors that deal on a daily basis with skin, I would say, are primarily the dermatologists and the plastic surgeons. What may be a little bit of a misconception on the part of our listeners is that the first stop always has to be a dermatologist. And I have great respect for my dermatology colleagues. We are essentially a referral destination by many of our dermatologists. But we, as plastic surgeons, are also very much well versed with the diagnostic element of whether this is something that is concerning, that should be biopsied, or it's benign and you don't have to worry about it. It is true that the total body survey of the skin generally occurs at the dermatologist's office. And if there is something that needs to be biopsied, sometimes the dermatologist will do it, and sometimes they will refer the patient to us, particularly if it's a sensitive area like the face or the breast or a very visible area about which the patient is concerned with regard to scarring. And of course, most of our listeners know that whatever we have on our skin is going to be either benign or malignant. I don't want the word malignant to scare everybody, but it is a cancer. The number one skin cancer on planet Earth in human beings the number one cancer in human beings on planet Earth is skin cancer. And so it's very, very common. The vast majority of skin cancers are highly curable and not dangerous and life-threatening. But there is one type of skin cancer that is definitely life-threatening, and that's called melanoma. And that is something that our listeners can be at least alerted to if they noticed a spot that they never saw before, or one that they thought they'd seen forever, but now it looks different. And so the things we look out for with regard to the concern of melanoma is a brown spot that looks really dark, almost like an ink spot. Or it was lighter and now it got darker recently. Or instead of being sort of round and regular, it's got a little projection, like a little finger, like a spider leg coming out of it. Or it's got multiple colors in one, a little brown, a little purple, a little blue, a little red, a little black. Those are the warning signs of something that could be very dangerous, and it absolutely needs to be evaluated by a qualified doctor, be it the family doctor, dermatologist, or plastic surgeon. And there are very specific stipulations about how it needs to be biopsied, how it needs to be evaluated, and how much of a margin one needs to remove. And the bigger the margin, the bigger the rim of normal skin around the lesion, the bigger the defect and the greater concern for scarring. And so that's where we're definitely getting into plastic surgery territory in terms of trying to leave the patient without any disfigurement, if at all possible. Sometimes it's completely unavoidable. And if you have a very large lesion that needs to be excised, it might require a skin graft or some other flap procedure. But as plastic surgeons, we're always worried about not only curing the patient of the skin lesion that they have, but reconstructing it in the most aesthetic possible way.
And when you talk about the process of someone seeing something or something becoming unfamiliar from what it was, talk about how quick that process is done versus maybe the dermatologist process. But just by going straight to a plastic surgeon, because again, I think what we forget in the perception, you're a doctor first, right? And then a plastic surgeon.
Right.
So I think just perception is reality, and we forget that part. So
absolutely, and I'm glad you asked that, because I often have this comment to my patients that the first hat that they see me wearing is my doctor hat, and the second hat they see me wearing is my actual plastic surgeon hat, meaning that my first concern is their overall health and wellness, and my second concern is what aesthetic concerns they may have, even if that's their primary concern.
Yeah.
So back to your question, I think routinely, when a patient wakes up with a skin question mark, what is this? Do I need to get it checked out? Their first destination may be the family doctor, and hopefully they can get in pretty quickly, but sometimes it might take a while.
For sure.
The family doctor may decide that getting into the weeds with this particular lesion is something they may not want to do, and they may default to a referral to the dermatologist. So that's their second appointment, and we don't know how long that one will take to get in. And then the dermatologist may see them, and depending on how big the lesion is or where it is in their body, and whether the dermatologist does or doesn't feel comfortable removing it, they might be up to their third appointment, which would be the referral to the plastic surgeon. So one of the things that I think is valuable to communicate to our patients is that they can actually schedule an appointment with us right off the bat. If they're pretty sure that whatever they have, whether they know what it is or not, but if they're pretty sure they want it removed, they can definitely skip the first two steps, call the plastic surgeon's office and say, hey, can I get something removed by my plastic surgeon, and can I get it done pretty quickly? It may or may not be done the day that they come in to see us, but oftentimes in our own practice, we're set up to schedule it exactly that way. So if the patient says, I'm not sure what it is, but I know I want it removed, and he or she communicates that to my staff, we will coordinate their schedule and my schedule such that we will be prepared to remove that lesion on the very day that they come in.
And when you talk about spots, we're talking about anywhere, right? Not just the face, not just a specific body part, but you can really look at anywhere, right? From head to toe.
Absolutely. We can evaluate wherever. Now, most of us don't look in every nook and cranny in our body. And that is something, for example, if the patient tells us that they have a history of melanoma, and there are some genetic mutations that actually predispose you to an increased risk of certain skin cancers, melanoma being the most scary and dangerous one. But the general total body survey does occur at the dermatologist's office. However, one of the things that we do, and we talked about usually small lesions, but some of our listeners may or may not know, everybody's heard of what's called a birthmark. And birthmarks can be so large that they can cover half an extremity or a whole back. And these are very scary things that we notice. Usually it's called a birthmark because you can see it in a baby. We're born with them. Congenital is the medical term for something you were born with. And the vast majority of birthmarks are large enough to remove, usually with one surgery, but sometimes it might require several stages. And the one I mentioned to you where it might cover an entire body part,
Right.
that might require extensive staged reconstructive surgery.
Right.
So we've seen all of that, and the ones that I described a moment ago, that's usually in the pediatric age group, and that's one of the areas I have particular fellowship specialty training in, which is pediatric plastic surgery. And one of the things that we'll see, it may not be a medical concern, as in a high risk for melanoma, but it's an aesthetic concern. For example, if we have a child or an adolescent, male or female, with a prominent birthmark on their face or on their thigh or on their breast or back, they may feel very self-conscious about getting into a swimming pool or just getting into some running shorts, and they want it removed. So this is definitely the area of the plastic surgeon, for sure.
And when you talk about pediatrics, you can work on anyone, right? You can see anyone. What are your patients' ages and your past experience on that?
All ages.
Right.
And the younger patient, probably under 10 or 11, if it's extensive surgery, we generally recommend doing that in the hospital setting with anesthesia, because we don't want the experience of the surgery to be traumatic psychologically for the patient. And we all know that little kids are not going to be welcoming any needles with local anesthetic. Most kids are scared of doctors and needles, and that is completely understandable. And even though we have pretty good office techniques to make sure that a lot of what we do is completely painless, sometimes just the anxiety associated with the entire experience is nice to avoid.
Yeah.
So I just had an example, for example, last week of a young teenage girl who had a birthmark very, very close to her groin. And it was large enough to warrant a pretty significant excision and scar. And that is something that we would not want to subject a young lady like that to, other than in the hospital setting. And all she does is hear from the anesthesiologist, okay, my dear, pick out a nice dream. And the next thing she hears is surgery's all done and you're in recovery room. And we really do like that for our kids.
For sure. I will say on your website, there are some incredible photos of before and afters of things that you have done in this field of dermatology. And so I encourage our viewers to go there to find those photos and look at those. So what is the biggest misconception, I guess, when it comes to the dermatology need or desire that someone, our listeners, may have? How quickly should they act on? I know you touched a little bit about it, but how quickly should they act on something that's unfamiliar on their skin?
So I would say that since most of our patients are not doctors and they're not sure about whether something needs to be evaluated, I would say err on the side of caution.
For sure.
And if it is a mole, and by the way, Courtney, the moles we want to worry about are the ones that are flat. If it's protruding from the skin, if it's got a little bump on it, those are usually not something to worry about. The exception to that would be usually in the older population, where there looks like something that is kind of scabby and maybe raised and they didn't notice it before. It may hurt a little bit. That could be a different kind of skin cancer called a squamous cell cancer. The most common cancer is a basal cell, otherwise known as a BCC for short. And that usually is a little scabby, itchy, bleeding something or other. And those are very, very slow growing and rarely dangerous, as in life-threatening. The squamous cell carcinomas in rare advanced cases can be life-threatening, usually in the head and neck area, but they can appear on the hands or on the legs for sun-exposed areas. The melanoma is the most dangerous one, and that's the one we really want to be attentive to, and that's the flat, dark, maybe multicolored, maybe funny shaped with little fingers and spider legs. Those are the ones we want to really be aware of. And I don't want to scare any of our patients and get the phones ringing off the hook, but most of us are pretty familiar with our body And most of us will notice something that maybe we didn't notice before.
Right.
And if there's a question about it, it ought to get checked out. The other thing that isn't technically on the surface of the skin, but it might be a bump we didn't notice before. Our patients and our listeners may have heard of something called a lipoma. That's a little benign fatty tumor that could be very small, maybe the size of a chickpea,
Yeah.
or quite big. It could be the size of a plum or even bigger. So that'll bring it to our attention when they feel it, either by washing in the shower or by sitting on it,
Right.
or by just noticing that they've got some discomfort in their shoulder or elbow if it's an area that kind of rests on a desk or on the car seat. So all kinds of things like that might bring a patient in. And then the third, probably the most common thing that we see that is skin related, is called a sebaceous cyst or an inclusion cyst. And that's usually a plugged sweat gland or pore
Okay.
that may grow slowly. Sometimes it can get infected, sometimes
Right.
it can drain. But a cyst oftentimes appears on the scalp, but it can also appear in other parts of the body. And a lot of dermatologists will see a sebaceous cyst and inject it with steroids. As plastic surgeons, we usually don't do that. We prefer to excise it because the steroid injection will usually not get rid of it forever. And sometimes steroid injections can also hurt. So the nice thing about coming to the plastic surgeon is we're very comfortable with cutting and stitching, and that is what we do. A lot of our dermatologist colleagues, some of them are trained well in dermatologic surgery and they can handle it just fine. But most dermatologists do scrapings and biopsies, but they don't do cutting and stitching very often. So if the patient is pretty sure that they're going to want something removed, it might just save them a little bit of time by coming straight to the plastic surgeon.
And what would you tell our listeners today with regards to protecting their skin? What is the most important thing that they can take away aside from all the knowledge and education that you just gave us about protecting the largest organ of their body?
Absolutely. So we all know a little bit about climate change and that the fact that our ozone layer is impacted, which
Right.
means that a larger concentration of UVA and UVB lights, sunlight is coming in and hitting us.
Right.
This is certainly true in some of the northern countries. It's true in Australia, which has the highest incidence of skin cancers. But as a general rule, most of us are not good enough with our sun precautions.
Right.
We should be wearing hats when we're out. We should be putting sunscreen on our faces and exposed areas, sure as brushing our teeth in the morning. And most of us are guilty as charged of not doing that. But the old concept, remember the commercials years ago of the old copper tone tan?
Yeah.
That should be highly discouraged. And even
Right.
though a lot of us really think it's beautiful and sexy to have a really pretty tan, we have to be very careful. And we know that sun exposure is cumulative, and most of the dangerous sun exposure will occur when we're children. And if we're on the beach without sunscreen, just romping around, and the light not only comes directly from the sun but reflects off of the white sandy beach, we are getting exposed. And that exposure is cumulative. The exposure we have to the sun cannot be reversed. And so we always want to be thinking about good sun precautions. Now, some sunlight is very healthy because that's the way our body produces vitamin D.
Right.
So one can definitely go overboard and not get enough sun if one is indoors or like really, really protecting. But we want to be conscious and aware that if we're out for long periods of time, we ought to have an SPF 50 or higher. And the SPF, the sun protective factor, relates to how long it is effective. And so one wants to use generally PABA-free, hypoallergenic sunblocks, and you want to keep applying it. That's very, very important. And when we're out and about, we probably want to have our sunblock available to us, either in our pocket or in our purse, because it will evaporate, it'll wash off, it'll lose its effectiveness after a short amount of time, usually a couple of hours, and so you want to reapply it if you're out all day long.
Very good. Dr. Kalus, it's always a pleasure. Where can people find out more about you and see those photos that we talked about? Where's the best way to do that?
drkalus.com.
Very good. Listeners, thank you so much again for joining us on Sculpting the Soul. And remember, beauty is not just about looks, but it's also about confidence and feeling your best. So until next time, thank you, Dr. Kalus, and we will talk again soon.
Thank you very much, Courtney.
Thank you.